The presentation today is about Distortion, created by Teresa Nguyen, Chelsea McKenna, and Karina Martinez. Let's begin by the definition of distortion. Distortion is one of the geometric properties affecting radiographic image quality. It gives a misleading presentation of size and or shape of image anatomical part. There are two types of distortion: size distortion that describes magnification, and shape distortion that describes elongation and foreshortening. Let's take a closer look. Magnification is only correlated with size distortion and is controlled by the SID and OID. The source to image receptor distance is known as the SID, is the distance of the tube from the image receptor, affecting magnification. The object to image receptor distance, OID, is the distance between the object to the detector. The closer the anatomy is to the detector, the less magnification and distortion. Meaning we want to increase SID while decreasing OID. Another note would be that we are able to calculate the degree of magnification by the formula M equals SID over SOD. To take it even further with the magnification factor, we are able to calculate the actual size of an object projected as a radiograph by the equation O equals I over M. Shape distortion is much simpler. It is misleading in the way that the image projected on the radiograph is either elongated, which means that the image looks longer than what it is. This is accomplished when the X-ray tube image receptor are properly aligned. Or it is foreshortened. The radiographed image looks shorter than what it actually is. This is accomplished when the anatomical part is improperly aligned. Now let's get to the point. How does distortion relate to the patient dose and or image quality? Although some magnification is possible in rad therapy, it is kept to a minimum due to the stable position of the source and image receptor, KV and MV, on the linic. Because they are a set distance apart, this can cause a greater magnification for a thinner patient or a lesser magnification for a larger patient. The therapist can reduce this, if necessary, by ensuring the image receptor is closer to the patient, decreasing OID. This is typically not needed, as the images taken are to verify patient and isosensor placement rather than to diagnose. Therapists do manipulate the OID by moving the vert of the KV imager and MV imager depending on the size of the patient and the field they are trying to capture, but the system already has set parameters. Elongation is not a factor in rad therapy because the source and image receptor will always be a set 180 degrees